As someone watching this video, you might be thinking, why is sleep important? Well, I'm about to tell you why. The functions of sleep are that you have a higher order cognitive function, which involves better memory, it's easier to learn, and a better metabolism.
Basics of the sleep cycle and rhythm. The sleep timing is influenced by homeostatic and circadian factors. Homeostasis related to adenosine, an organic compound produced in the brain. During the day, this compound increases, and during the night, the compound decreases, where levels during the day make you more tired, and then the body breaks this down at night. The internal body clock regulates your sleep cycle, controlling when you feel tired, when you're ready for bed, when you feel refreshed and alert. And this internal body clock operates on a 24-hour cycle known as a circadian rhythm. Likewise, it revolves around this kind of sleep cycle where the less sleep you get, the more sleep you need, and the more sleep you get, the less sleep you need. And during the day, twice our alertness level peaks and our sleepiness peaks. The brain operates in three states: awakeness, NREM, and REM. And during NREM, there revolves around three stages. The first being the brain and body activities tend to slow down with periods of brief twitches, and light changes in the brain activity associated with falling asleep in this stage. It's easier to be woken up, but generally, if the sleep goes uninterrupted, you won't spend much time in this portion, and it'll generally last 1 to 5 minutes. During stage 2, the body drops in temperature, your muscles relax, your breathing slows down, and your heart rate slows down. And at the same time, the brainwaves show a new pattern, and the eye movements tend to stop. On the whole, the brain activity slows down, but there's like small bursts that help resist being woken up from external stimuli. This stage generally lasts from 10 to 25 minutes during the first sleep cycle, and each time it proceeds after that, it tends to become longer during the night. And you tend to spend around 50% of sleep in this stage. During stage 3, this is known as deep sleep. It's harder to wake someone up when they're in this phase. The muscle tone, pulse, and breathing rate decreases, and the body further relaxes. This is critical for restorative sleep, which results in benefits to the immune system, other bodily processes, recovery, and it stimulates growth. We tend to spend most of the time in deep sleep during the first half of the night, and during the early sleep cycles, they tend to last from 20 to 40 minutes. And then as you continue to sleep, these cycles get shorter and more time is spent in REM. During REM, the brain activity picks up, nearing levels when you wake up. But the body is in a temporary state of paralysis of the muscles, not including the eye and muscle controlling breathing. It's also associated with rapid eye movement, which is why it gets its name REM. And it's believed to be essential to cognitive functions like memory, learning, and creativity. It's also generally mostly responsible for the most vivid dreams, which is explained by the uptick in brain activity. Dreams can occur in any sleep stage, but they're more common during this stage. And you won't tend to go into REM sleep stage until about 90 minutes into your sleep. And as the night goes on, the stage gets longer, especially during the second half of the night. And while the first REM stage may last only a few minutes, late night stage can last around an hour. And in total, it makes around 25% of sleep in adults. Sleep debt. Sleep debt is the difference between the amount of sleep someone needs versus the amount they're actually getting. The issue with this is that sleep debt is cumulative, which means after going to sleep 30 or 60 minutes later than usual, after a few days, it can quickly add up. It can result in drowsiness throughout the day, which can affect work, taking an exam, learning, and a lot of the social activities that we're involved in. But more importantly, drowsiness is red alert. With enough sleep debt accumulation and drowsiness, an individual can be involved in life-threatening accidents. For instance, 1 in 5 motor vehicle crashes is associated with sleep-related impairment. Drowsiness can result in life-threatening issues not only to yourself but to the people around you, and so you want to make sure you're getting enough sleep throughout the night.
Now let's talk about some common sleep disorders. Insomnia is a condition that makes it hard to fall asleep and to stay asleep. It can be caused by stress, poor sleep habits, including having an irregular sleep schedule or using screens before going to bed, mental health disorders like anxiety and depression, and is also associated with other sleep disorders. Sleep apnea is a sleep disorder in which you stop and start breathing repeatedly while sleeping. Some symptoms include snoring, waking up gasping or choking, and being excessively sleepy during the day. There are two types of sleep apnea: obstructive sleep apnea, which is more common, and central sleep apnea. In OSA, the cause of these symptoms is due to throat muscles relaxing and blocking the airway, whereas in CSA, it's the brain that fails to tell the body to keep breathing. Risk factors for sleep apnea include obesity and older age. You're also more likely to have sleep apnea if you're male or a smoker. Parasomnias are a category of sleep disorders that involve unusual and undesirable physical experiences that disrupt normal sleep. Some parasomnias include sleepwalking, sleep terrors, and confusional arousals, which is when someone appears to wake up but they behave strangely or unusually. These can be caused by stress, anxiety, depression, certain medications, substance use, and other sleep disorders. Restless leg syndrome is a condition that causes an urge to move one's legs because of abnormal, unpleasant feelings in the legs or feet. The symptoms usually worsen in the evening and occur when lying down or sitting for a prolonged period of time. The cause of restless leg syndrome is unknown, but is often hereditary and associated with pregnancy. It's more common in women and in older people. Narcolepsy is a condition involving overwhelming daytime drowsiness and sudden attacks of sleep, as well as sleep paralysis. There are two types of narcolepsy. Type 1 occurs with cataplexy, which is when your muscles weaken suddenly and in the more severe cases can cause someone to collapse to the ground. Type 2 occurs without cataplexy. The cause of narcolepsy is unknown, but those who have a family history of it are more likely to have it as well. Circadian disorders include jet lag disorder, which is when your sleep-wake rhythm is out of sync with the local time, making you feel sleepy or alert at the wrong time of day or night. Another circadian disorder is delayed sleep-wake phase syndrome, which is when you fall asleep later than you would like and find it difficult to wake up in the morning. Circadian disorders occur when your sleep-wake cycle is out of sync with the environment. While sleep disorders have multiple and complex causes like stress, mental health disorders, medications, age, gender, obesity, and many more, these causes are often associated with each other. Most sleep disorders can actually be treated by simply practicing better sleep habits.
Now let's get into sleep misconceptions. It is important to know these to improve your sleep. Let's dive right in. Hitting snooze is better than getting up right away. This is false, since repeated sleep interruptions by the snooze function are correlated with reduced mental flexibility and decreased subjective mood. Instead, set an alarm for the right time. And what about someone saying to sleep when you want to? This is false, since any sleep is better than no sleep. If someone ever tells you alcohol before bed will improve sleep, do not listen to this advice. Alcohol is a depressant. The consumption of alcohol has been linked to poor sleep in quality and duration. And remember, 1/3 of your life goes to sleep. Make sure to take care of your sleep habits to get more out of life.